Hello viewers, my dear students. I am Rafi, lecturer in zoology subject, and my YouTube channel is Rafi's Lectures. You can share and subscribe. Today's my topic is common cold. In local language we call it the bad cold for class 12 students. So let us begin. Let us start the common cold. What is meant by common cold? Common cold. It is the most infectious human disease. It is the most infectious human disease. It is caused by a group of viruses. It is caused by group of viruses. It is the most infectious human disease. It is caused by a group of viruses. Rhinoviruses. Group of viruses, rhinovirus. Infection is airborne. The infection is airborne or droplet infection. Droplet infection. I will repeat here. It is one of the most infectious human disease. It is caused by a group of viruses called rhinoviruses. The infection is airborne or through droplet infection. The viruses are transmitted directly through the inhalation of droplets. The virus are directly transmitted through inhalation. We inhale the droplet resulting from the sneezing of infected persons. The virus infects nose, and respiratory passage, but not lungs. Lungs is not involved in the common cold. The person are either inhaled directly or transmitted through contaminated objects. He inhale or take the contaminated objects, contaminated things, uncovered things such as pens, books, cups, doors, knobs, computer keyboards, and mouse, etc. and cause an infection in a healthy person. The common cold is caused by rhinovirus. I already told that it is caused by rhinoviruses. It is caused by the rhinoviruses. Single stranded, positive stranded naked RNA virus. Rhino means nose, which belongs to the picornovirus. Pico means small group. The virus are transmitted through droplet nuclei, pharyngeal and nasal secretions. Adenovirus infection often are responsible for common cold. Adenovirus colds are distinctive because the fever is substantial and the throat is very sore and the cough is usually severe. If you go for the cause of this incubation period, first is the incubation period. Incubation period of this disease, common cold, is few hours to few days. Few hours to few days. This is the incubation period. Now we go for the causative organism. How it is caused? Causative organism. It is the viral disease. Causative organism is the rhinoviruses. This is the causative organism causes because the common cold separate through droplet from talking, sneezing, direct contact, handshake. It is highly infectious disease caused by more than 100 types of virus. More than 100 types of virus. More than 100 types of the viruses. The virus attack upper respiratory tract. It attacked the upper respiratory tract, causing acute infection to mucous membrane of nose and throat. The irritant is released by the viruses during the damage causes nasal congestion and discharge. Sore throat, coughing, these symptoms are also typical in respiratory infection. Caused by bacteria and allergic conditions, the symptoms are same as that is the common cold. But with high fever, headache, aches in joints, nasal congestion, and headache can also be indication of the sinusitis. If you go for the causes, this transmission mode, how this disease transmit from one person to another person, how the person get this infection. You all know that common cold was formerly thought to result from exposure to cold. Some people say this, exposure of cold weather. But this misbelief forced the people to remain indoors, resulting in efficient transmission of virus from person to person due to crowding. These viruses separate through nose, but not through mouth. It separates through nose, but not mouth. It separates through nose, but not mouth. And this disease, the person to person due to crowding, I have already told this virus separated from nose but not from mouth in form of droplets produced by sneezing. Droplets produced by sneezing. The virus can also transmit from one person to another person from hand-to-hand contacts. I already told you hand-to-hand contact, handshake. Chilling also believed to cause a cold. Chilling also believed to be cause this common cold may contribute the infection. But in some studies suggested that it is not the major importance. 40% common cold is caught in summer. Is caught in the summer. If you go for symptoms of this common cold, यानी कॉमन कोल्ड के कौन से अलामत है? सिम्टम्स ऑफ द कॉमन कोल्ड. Symptoms of common cold. If you go, there are so many symptoms of the common cold. Disease is caused by the nasal congestion, sore throat, headache also, tiredness, etc. Attack lasts for 3 to 7 days. 3 to 7 days, cough, hoarseness, and headache, watery eyes, sneezing, excessive nasal excretion, and cough. It mainly affects the nasal epithelium and upper part of the respiratory tract, but not in lungs. Lungs are not involved by this common cold. There is irritation of nasal tract, nasal congestion, full of mucus, sore throat, I have already told, slight fever. Some persons have been observed some persons also suffer from allergic rhinitis common cold, separate throat, droplet from talking, sneezing, direct contact, hand shaking. Burning sensation is also observed in this common cold in some people. The virus may pass through nasolaryngal duct into the eyes and infect conjunctival ducts into eyes. In acute cases, infection separate through estrogen tubes in the middle ear. It's separate for the estrogen in the middle ear. Middle ear. If we go for the prevention and control of this disease, prevention and control of this disease. You all know that prevention is better than cure. Prevention is better than treatment. We should prevent this disease. Prevention is better. We first isolation the patient. Patient should be isolated from the normal person. Sterilization of articles, cloths used by patients. Avoid contacts, dust and dirt. Avoid already suffering persons. Sterilization of articles used by patients. Bed rest is commonly recommended to avoid complications. In a bed rest and also we should not take uncovered food. In a this contaminated water, we should not take these things, infectious things, uncovered fruits, uncovered things. These are the prevention and control. Now, if this disease suffers to a person, we go for the treatment, we go for the doctor, and doctor give the medicine of this disease. Treatment, first treatment is that you should go for saline gargle. You should gargle 3 to 4 times in a day or 2 times in a day. And this congestants are used to give relief to the patients. Antibiotics are recommended to somehow by preventing secondary infections because there is no treatment because this disease it takes the life cycle from 4 to 8 days or 7 days and go away. It completes the life. This virus completes the life cycle and go away. It cures automatically about 3 to 7 days. 3 to 7 days. It cures automatically because virus will come the life cycle. Medicine are taken to reduce the severity of nasal irritation and clearing nasal tract because changing of nature of virus, there is no known case for the common cold. No preventive drugs has been yet founded. Although various antihistamine drugs were formerly claimed to the effective in the prevention of the cold if taken at the beginning, but are now discredited. Presently, most of the researchers of this opinion that such drugs are not affected the progress of true virus responsible for causing common cold. You know the Linus Pauling and Nobel laureate proposed that large dose of vitamin C can shorten the duration of the cold and decrease its symptoms. And it is also believed that vitamin C boosts the immune system and our immune system becomes strong. Vitamin C boosts the immune system and reduce the inflammation of the presently maximum concentration is being given unto relieve the symptoms. And such drugs are being given to the patients which contain maximum quantity of aspirin, antibiotics. Antibiotics shows being given to the patient which contain the maximum quantity aspirin in an antibiotic should not administered as the colds or caused by viruses. This is an important point. We should not give antibiotic to it is a viral disease. We should not give the antibiotic. Shows not administered as colds. It is caused by the virus. It's a viral disease, not bacterial disease. Recent research conducted suggested that prostaglandin released in the body during the common cold are responsible for causing pain or responsible for causing pain in the chest, congestion and sore throat. So this is a common cold it is the common disease to our body. We get common cold anytime, but we should not worry of this common cold. It automatically cure nature by himself. So, dear students, rest is okay.